Carson from the Institute for Healthcare Improvement. Welcome to our virtual conversation series, Leadership Insights, where we talk with IHI's experts and partners. Today, it's my privilege to speak with Hillary Heichman, Senior Program Officer at the Robert Wood Johnson Foundation, where we're going to get the opportunity to talk about IHI's work on centering equity and shifting power. Welcome, Hillary, and thank you so much for talking with me today.
Hi, Marianne. It's great to be here. I'm glad to get this opportunity.
Hillary, our journey together is possible through the 100 Million Healthier Lives initiative that IHI convened and RWJF so generously helped to fund, particularly via the SCALE initiative.
Yeah.
We've had the privilege of leading this bold initiative together and with so many amazing partners and communities aimed at transforming how the world thinks and acts about health, well-being, and equity. And I know that you are a champion for public health with a passion for strengthening community health systems. Amid all that you are juggling in your leadership role at RWJF, could you share why 100 Million Healthier Lives was needed and how you think it might have a long-lasting impact on communities?
That is quite a question to kick us off with, Marianne, but I love being asked. You know, the kinds of challenges that people in towns and cities across the country that they're looking at, they're big and complex challenges. You know, at the time that we were in the midst of 100 million healthier lives, it was things that now in a time of COVID are still really big and important. Things like the opioid epidemic, aging well, kids getting a strong start, structural racism, families facing all the kinds of burdens and things that make it hard to be healthy, and so forth, many other things. And those were big then, and they're really important now, these big complex challenges that people are. And every time that I get to visit a place or maybe support it because of this role that I have as a program officer at the Robert Wood Johnson Foundation, I see that, you know, communities all across the country have these special strengths to work with. So we have these complex challenges, and we have these special strengths and assets in communities all over the place. And what this adds up to meaning is that it takes a concerted, connected effort to face these complex challenges with a shared vision, with distributed leadership, with a central role for people who are most affected by these challenges. So 100 Million Healthier Lives wasn't just an initiative, it was a networked approach to change of the kind that's needed to face the complex challenges that communities and organizations across the country are facing. It's one that supported and helped organize people and organizations and communities. It's one that helped them make, make and develop skills and face these complex challenges together. And it's one that made space for and lifted up all different kinds of leaders.
Thank you. So you've done such a lovely job of answering that first big question. I'm gonna keep them coming.
Let's do it.
Great. Creating a culture of health with equity at the center and shifting power to and supporting power building in and with communities. I know that's a central focus for the Robert Wood Johnson Foundation.
Yeah.
I'm curious about whether and how the 100 Million Healthier Lives work supported your goals to set a national agenda to improve health, well-being, and equity.
Great. So it has, you know, different efforts within 100 Million Healthier Lives. There's been all of these great activities, including SCALE, which you mentioned in your tee up. All these different activities, many of them built different practical guidance and tools. Things like the race equity map that's now available on Community Commons. That we and that groups we fund, we as the Robert Wood Johnson Foundation, are finding really valuable. I mean, So many great tools and guides came out of 100 Million Healthier Lives. I can't say it enough. I want to emphasize it for anybody who watches this. Also, that efforts within 100 Million Healthier Lives taught us a lot about not just engaging community members in things happening to improve their community and their state, but like, and not only just asking them what they think, but really involving people in the change processes. And especially, people with essential lived experience of the challenges related that inequitable systems contribute to, so that they are able to like shape and lead the direction that communities take in response to them. Like, we really learned a lot about how the practical, like how you do it, how you support that kind of change, that kind of co-creation and shared leadership with community. It's really been valuable for us, my colleagues and I at the Robert Wood Johnson Foundation. Also, actually, I'll add that 100 Million Healthier Lives as like a concerted national endeavor, it's been an inspiration in a lot of ways.
Thank you. I'd love to sort of follow that thread that you were just teeing up, Hillary. As we think about the work that 100 Million Healthier Lives helped to accomplish and its focus on population and public health, particularly related to the notion of creating lasting capabilities, drawing upon existing assets, unlocking those, and achieving sustainable and more equitable outcomes. As you think about all that, what are the lessons or strategies that we might draw upon, given what our organizations, communities, and the public health system are facing today?
Communities could, so one of the things that I watched you all work on, and in all the different places you worked, in the teams and communities across the country that you worked with, is that a lot of that communities know what they need and are going to be most motivated by their own priorities and their own vision. And often what they're missing is an understanding of sort of the trajectory and the paths to get there and the skills to follow those paths. So the idea of like, let's focus on a set of skills, let's define a set of skills and really work with teams of people from different parts of a community and help them build those skills. Like, watching that happen in 100 Million Healthier Lives, I really learned a lot from. The idea of measuring progress and continuous measurement, the way that you were able to bring in so much of IHI's expertise related to measurement and continuous improvement, and apply them sort of in community settings and with all different kinds of people and organizations, was hugely valuable. And related to that, I always loved the emphasis on failing forward, because we're always learning, we're always watching how things are going, we're measuring our progress. And so we're able to continuously improve. And so let's fail forward. These are just a few examples of some of the things that I really loved learning from and alongside people in 100 Million Healthier Lives.
Thank you for sharing those, and for all the ways that you truly did learn alongside and with us. And thank you for continuing to answer the big questions that I am sending your way. Here's the next one. One of the foundation's action areas for creating a culture of health is to make health a shared value. Mm-hmm. Do you have the sense that people in general, as they think about health as a shared value, understand and or value well-being, not just necessarily for individuals, but also for their entire community? And I'll toss in a second part to that, which is, do you think that COVID-19 and all that has exposed has had any effect either of intensifying or diminishing our shared values on health, well-being, and sense of community?
So I think that people know what they and their family need to be healthy and have well-being. And I think that people in positions of power in government or business or healthcare, other kinds of organizations that try to help families should listen to people, to families about what they need to have health and well-being. And actually, that's a pretty great way to get to a shared value for health. Um, Specifically, you asked about in this period of COVID-19, and if it's intensified or diminished our shared value for health and a sense of community. So to answer that, I think we've seen a shift in a pattern rather than just like a unidirectional shift towards intensified or diminished sense of shared value for health and community. I think we've seen extraordinary efforts of people coming together with a shared value for health and what they can accomplish together in the face of the problems that COVID-19 has caused and unearthed. I also think we've seen a lot of people feeling let down or left out and not feeling like there's a shared value for health with others around them. Importantly, yes, I would say I think we've seen enough joint extraordinary effort to really hold up as examples and to, as much as possible, keep building from there. So I feel really hopeful about this as a direction overall, but I do think it's been not just sort of a direction towards everybody excitedly all at once having, only an intensified shared value for health. It's complicated, but I really appreciate the direction of what we've seen.
Thank you. Yes, and we've certainly learned together about complexity and how people and communities respond in the face of complex adaptive change. And if this moment isn't a moment of complexity, I don't know what is.
Yeah.
We've been speaking a little bit, and you've already shared some of what you think are some of the big lessons from this work. I'd love to learn from you, what are some of the lessons that you see that support the Robert Wood Johnson Foundation's current areas of focus and strategy? And how do you see healthcare and public health and communities continuing some of this momentum towards healthier and more equitable lives for people and communities?
One of the things I really appreciate is when you sort of learn a lesson from somewhere, but then you also have it reinforced from other sources and other angles. So one of the lessons I definitely feel like I and many of my colleagues sort of saw and learned from 100 Million Healthier Lives, one of them is we can't all just keep dancing around the edges of talking about equity like it's just an idea. That it really calls on us, this time we live in really calls on us to face structural racism and other forms of inequity and to take practical actions to work on them. And in many cases, it's facing things about ourselves and our understanding of what's normal and the way things have tended to work, because they haven't been fair for everyone. So this idea that we can't keep dancing around the edges of equity and just saying the words without taking more deliberate practical actions. So that's one. A second one I'll say is, really appreciated learning from 100 Million Healthier Lives, an example of what it can look like to build infrastructure for change. In these days where in the news people are talking a lot about infrastructure, but this idea of infrastructure for change, the kinds of supports, the kinds of processes and resources that people and communities and organizations need and able to not just work by themselves, but work together and see what's happening in other places and understand their progress and improve as they go, and also draw on different kinds of resources all across the country. This idea of building sort of networks that can be touch points and support for communities as they work on improving health and equity. So infrastructure for change is a thing that 100 Million Healthier Lives has been that, and I really appreciated the example that it set for what that can look like for people all across the country working together. And I'll just quickly mention then distributed leadership. I've learned so much about how distributed leadership can look in practice from watching 100 Million Healthier Lives.
Thank you. I'd love to turn now to a couple of questions about the current moment that we are living through together.
Mm-hmm.
While COVID-19 has, and all that it has exposed, has accelerated systemic changes that were apparent before its inception, over these last months, it has exposed even more challenges and inequities in our healthcare and public health and community systems. Those fault lines that began to emerge in 2020, now as we're having this conversation in early 2021, appear at sort of to be at a critical crossroads. And from your viewpoint as a longtime public health champion, how has the pandemic impacted public health?
In some ways, the field of public health has been galvanized, and it's also been really valuable the extent to which people in positions of in powerful positions and all different kinds of people all across the country sort of see public health do its work. And I think that's really valuable when our society, when our country sees public health doing its important work, when it's not only behind a curtain. I also know with certainty that the field of public health are the organizations that people have been stretched to their very limits and beyond their limits, and that they're living with a lot of stress. They continue to do really important work under so much stress and strain. People are dropping out of the field. Organizations are not even able to do all the things they're supposed to be doing because they're so focused on helping their communities and their states through COVID. Many people are starting to feel like the end is in sight for COVID-19, but public health is still very much in the middle of this pandemic. It's quite a challenge to them. So it's COVID-19 has impacted the field of public health in ways we can only begin to sort of explain in this or talk about in this like quick conversation we get to have.
Thank you for how clearly you framed that up, and you echoed back to some of what we had been speaking about related to well-being. I heard you, for me, it was echoes about well-being of the field and the people who work within it. So thank you for that perspective. Continuing along those sort of similar lines related to these moments that we're living through, even before the pandemic, we failed to address many of the longstanding, troubling, harmful things that we already knew about health inequities, racism, racial inequity in the United States. From where you sit and what you see, what role might the Robert Wood Johnson Foundation play in helping to reduce the disproportionate and inequitable burden of COVID-19 and its impacts, and working together to improve the health of all people?
Thank you. That's another sort of big and exciting question to get to answer. And so I'll say that I will answer based on some of the opportunities and things that my colleagues and I are talking to each other about, and but maybe this isn't a complete answer for all of the Robert Wood Johnson Foundation. So importantly, I think that one role that we can play is in really deliberately, intentionally facing structural racism and white supremacist systems that are around us and that are a part of sort of the systems that contribute to or make it harder to have health and well-being. And sometimes this, because of the sort of the role and the attention that RWJF has and can get, that we are facing it deliberately and intentionally, and calling attention to it can hopefully be valuable. That's one thing. Second of all, I know that we have and will continue to focus effort on improving systems and policies that that most affect and can most help people who bear the worst effects of inequitable systems. So there's certain systems and policies that we can, hone our attention on and try to help enable and move forward. We can use our resources to fund and enable and get out of the way of all different kinds of leaders in communities all across the country. And then also we can promote policies and conditions that help level the playing field for people, using our resources, using our power. Those are just a few examples. This is actually something we could go on and create lists for, but I'm happy to share those few examples at least.
Thank you. You know that I love shared list making, so I look forward to that conversation too. As we come to wrap up, we've been talking a lot about big systems things, big organizational things, and from being on this journey together over the last several years that a core part of 100 Million Healthier Lives and what we've learned together is about the change that happens from within each of us and what we each need on our own journeys as leaders in any particular moment. And so I'd love to turn to the individual and ask you a question about, over the last year, how have you as a leader personally adapted and kind of gotten through? What's tested you the most, or what practices have you relied upon to get through this last year that, as you said, is continuing?
I think maybe the most important thing I can say that's shaped it's been a part of the leader that the kind of leader I've tried to be in the last year is the extent to which I think increasingly I've tried to listen let me put it this way, to ask people people and organizations and groups of organizations, networks of organizations like those that we work with and to fund at the Robert Wood Johnson Foundation, to ask them what they need to succeed and thrive, and to listen really carefully to what the answer is. And I also think that and also many of my colleagues I work with, but certainly I've tried to listen to different kinds of voices than what I've sort of defaulted to listening to in the past. And so I think I'll leave it at those two things in particular, but so much of it really is about listening better.
One of the things that's been amazing about our partnership is the extent to which you really do listen, and that question has always come from a really authentic and genuine place. So thank you.
Thanks.
My last question for you is, as we reflect on this conversation and this journey we've been on and what the future might hold, how can public health organizations and professionals evolve to fundamentally transform the way that people and communities think and act about health, well-being, and equity?
Yeah. Thank you. First, let me give props to public health organizations and professionals. The amount of themselves that they are giving to their communities, to their state, and to this country is just really extraordinary. I don't even know how to show all the appreciation that I feel for it, for them, for what they've done, what they're doing, and what they continue to do, endless hours every day. So I think I'll just focus on two things for this last question as we wrap up. I think that public health organizations and professionals should lean into their strengths, things like relationship management, measurement, community-based participatory research, translating data into programs and policy, adapting to change, balancing long-term and short-term planning and action. These are things that the public health professionals and organizations tend to do really well, and often better than other sort of institutions. I also think, so lean into their strengths. I also think It's important to expand on their strengths through connecting and working in a more networked way, and by letting people most affected by the inequitable systems in their communities that they serve lead them, so that they are really truly creating solutions together. So leaning into their strengths and continuing to build on their strengths are really the sort of two kinds of thoughts that I have on that. Um, and very briefly, it's also reflected in the revised essential public health services that the Public Health Accreditation Board recently released in the last few months. These same ideas. And as I say that, it also strikes me that IHI has particular strengths related to some of those things that I mentioned that map well to some of the strengths that the field of public health has and can lean into, especially things related to measurement and translating data into practical programs and policy that are actually really relevant to the field of public health. So it seems like a nice way to wrap up that thought as I'm talking to someone with IHI. But it's, thank you for asking.
Thank you. It was my privilege to ask. To have the opportunity to be in this work with you over the last several years and to be in this conversation with you today. Thank you, Hillary, for sharing your insights, your lessons learned from all of this work in partnership and from all of the work that you do. I am so grateful for who you are, for the work that you help to lead every day, and for how you do it as you're working to really, really put all of yourself into improving health, well-being, and equity for communities across the country. So thank you.
That is so kind of you. Thank you, Marianne. Thank you for inviting me for this conversation. It's been fun to think through these questions with you. As always, I love thinking with you and talking things out with you. So it's been a great conversation. Thank you.